Assalamu alaikum guys. Today I would like to discuss about hypertension, its causes and its pathophysiology and its management. First of all, I would like to start from the blood pressure. What is blood pressure? So blood pressure is defined as the pressure which is exerted by the blood against the blood vessels. Is called blood pressure. Blood pressure is defined as the pressure which is exerted by the blood against the blood vessel is called blood pressure. Or simply you can calculate is BP is equal to cardiac output multiplied by total peripheral resistance. It's mean cardiac output is related to systolic blood pressure and total peripheral resistance is related to diastolic blood pressure. If you increase cardiac output, so systolic BP will be elevated, and if you increase total peripheral resistance, so diastolic BP will be elevated, and if you rise both of them, so systolic and diastolic both will be elevated. Now what is cardiac output? Cardiac output is defined as the amount of blood volume ejected by the heart in 1 minute. Cardiac output is the amount of blood volume ejected by the heart in 1 minute, or simply you can calculate it. Cardiac output is equal to heart rate multiplied by stroke volume. Now what is stroke volume? Stroke volume is the amount of blood ejected by the heart in single beat. So normal heart rate is about 70 and stroke volume is 70 ml and heart rate is 70 beat per minute, so is equal to about 5000 ml or 5 liter. So 5 liter or 5000 ml is the cardiac output of the heart. Now what is hypertension? So elevation of systolic or diastolic blood pressure in the artery is known as hypertension. Now what are the causes of hypertension? About 95% cases the cause of hypertension is not identified, and it is called primary or essential hypertension. And 5 to 10% the cause of hypertension is identified, and it is because of the underlying diseases like heart diseases, kidney diseases, endocrine diseases, etc. but there is some risk factor for to cause primary hypertension, like age. Age is 25 to 50 year, and genetic factor. It's mean if you have a positive family history of hypertension, so you can get hypertension as well. uh, Third one is increase salt intake more than 3 gram per day. If you take more than 3 grams salt per day, so you can get hypertension. Fourth one is excessive alcohol intake. Alcohol intake. Fifth one is obesity or lack of physical activity. The sixth one is stress, anxiety. Seventh one is polycythemia. Uh, Now I would like to discuss about the pathophysiology of hypertension. So you will understand the pathophysiology of primary hypertension. Pathophysiology of primary hypertension. It may be due to overactivity of the sympathetic nervous system. If sympathetic nervous system is activated, sympathetic nervous system is activated, it is the nerve of sympathetic nervous system, so it release norepinephrine. Norepinephrine here in the blood vessel. Here is smooth muscle. It contracts the smooth muscle, leads to vasoconstriction. Vasoconstriction leads to increase total peripheral resistance, and it leads to increase BP. It is the first way. Second, this norepinephrine act on the heart synode and increase heart rate and heart rate increase cardiac output increase BP. Same, this norepinephrine act on the myocardium ventricle and increase myocardial ventricular contractility. So it leads to increase in the stroke volume. Stroke volume leads to increase cardiac output increase BP. Same, this epinephrine act on the kidney and increase renin. Renin increase angiotensin 2. And as we know that angiotensin is a potent vasoconstriction, so it leads to vasoconstriction it increase ADH level and also it leads to aldosterone elevation. Aldosterone elevation. Combine these three increase blood pressure. Now decrease sodium excretion. Decrease sodium excretion. So whenever sodium not excreted from the kidney, so sodium retention occur. So extracellular fluid will be increased. Extracellular fluid when will increase, then increase blood volume leads to increase venous return leads to increase in diastolic volume and it leads to cardiac output and increase BP. Also this sodium acts on the blood vessel. Sodium contract the smooth muscle leads to vasoconstriction and finally increase total peripheral resistance and leads to increase BP. So it was the mechanism or pathophysiology of primary hypertension. Now what are the causes of secondary hypertension? First of all, renal parenchymal diseases. It's mean disease in the renal parenchyma like chronic glomerulonephritis and diabetic nephropathy and polycystic kidney diseases and nephrotic syndrome. The second one is renal vascular diseases. Here is stenosis occur in the renal artery, so the sodium will not excreted in urine, it will build up in the artery, so cause reabsorption of water. It will leads to increase blood volume and it will leads to increase blood pressure. Other than is vasculitis. Now endocrine causes. it is adrenal gland, and this part is known as zona zona glomerulosa, and this one is known as zona fasciculata, and the third one is zona reticulosa, and this is medulla. So here increase aldosterone occur, and it leads to a condition called Cohen syndrome. Cohen syndrome. So when ADH level is aldosterone level is increased, it will leads to sodium and water reabsorption. It will increase sodium and water reabsorption. So blood volume will be increased and BP will be elevated. Also this layer it is zona fasciculata, it secrete cortisol level. So here a disease called Cushing syndrome. In Cushing syndrome, here is increased production of cortisol. Increased production of cortisol leads to increased epinephrine and norepinephrine receptor sensitivity. It will do two things. One, it increase heart rate. It increase stroke volume. Stroke volume will be increased. Then cardiac output will be increased, and BP will be elevated. Second is this leads to vasoconstriction and then leads to increase in the BP. Now here a disease called peuchromocytoma. It is a tumor of the medulla of the adrenal gland. Whenever it occurs, so it leads to increase in the secretion of epinephrine and norepinephrine. As we know that these two will increase renin angiotensin aldosterone excess. One, the second one is increase stroke volume. The third one, it increase contractility of myocardial ventricle. So ultimately it leads to increase in the BP. And endocrine, here is another cause which is in the thyroid gland. It's called hyperthyroidism. Hyperthyroidism means increase T3 and T4. It works on heart and increase heart rate, which is leads to increase cardiac output and leads to hypertension. Also T3 and T4 act on epinephrine and norepinephrine receptor sensitivity, which leads to increase in the contractility of the heart and increase in the BP. Another condition is called hypothyroidism. In hypothyroidism, there is decrease in the secretion of T3 and T4. So, if T3 and T4 is decreased, it will lead to increase sodium and water reabsorption. Increase sodium and water reabsorption leads to increased blood volume and ultimately leads to elevation of the BP. And here is another condition called hyperparathyroidism. This means there will be increase in the secretion of parathyroid hormone. So if you have hyperparathyroidism, so parathyroid hormone will reabsorb more calcium from the gut, and calcium act on the smooth muscle of the vessels, and it will lead to vasoconstriction and ultimately increase total peripheral resistance and leads to increase BP. And here is another condition called correction of the aorta. It is just because of if you consume excessive alcohol, so your aorta will be narrow and here will be resistant produce, so pressure will develop back and it will lead to increase in the BP. Also another condition which increase BP is known as eclampsia and preeclampsia. Other than there is some drugs like combined oral contraceptive pills. What it do? It contain estrogen. Estrogen leads to in the production of angiotensin 2, and it leads to vasoconstriction and finally increase in the total peripheral resistance and leads to increase in the BP. So it was the mechanism of action or the pathophysiology of secondary causes of hypertension. Please subscribe my YouTube channel for more medical lectures and surgical videos. Thanks a lot.